Doctor, thanks for taking the time to talk to me really quick. I just have a couple of questions for you if you don't mind. I wanted to
Sure.
ask you about just the number of cases here. Nevada has now seen its highest number of cases since this pandemic began. What concerns you or alarms you about this now record number of cases?
We have been seeing an increase on the number of cases since the first week of June, and it has been a progressive increase. We also there are different reasons for that. Of course, one of them is that we are offering more testing to the community, but testing alone doesn't explain the number of cases that we have today. We also are seeing a higher positivity rate on the testing, meaning that a larger proportion of people who is tested today is being reported as positive, which is different from the months of May or April. So, and what it means really is that there is an increased transmission of the virus in our community. So testing itself doesn't explain that. It's just the higher transmission. And this is something that we attribute to increased connectivity movement of the population in the community, because the labor force now is uh, fully participating at the different industries that we have in the community. So that increased the interaction of people once another. Also, what we have seen is that in previous weeks, of course, limited compliance with the preventive recommendation for the use of masks or facial covering, as well that the social distancing recommendations. Also, the message of stay home as much as possible if you don't have something that is critical or important to you. Better stay home. So, in other words, a lot of community interaction out there, and just recently, in few days after the governor directive in the use of masks in public places, we are seeing, I would say, a higher proportion of people really wearing the mask in public, which is going to help, and also the the compliance with social distance. We are seeing more cooperation also from the business in the community in that regard, and that should help eventually in decreasing the transmission in the community.
Doctor, should we look into the timing of this? If we back the clock up 2 weeks, that was right around 4th of July, a big holiday weekend. Perhaps people were gathering. We saw large gatherings on Fremont Street, Lake Mead, those kinds of places with maybe little to no social distancing, people wearing sporadic face coverings, some not. Is the timing of this interesting in your perspective, or is that not something that is necessarily important, I guess, in terms of the timing of this increase, this record number of cases?
No, it's important because again, 4th of July, of course, implied a larger movement of the population, people visiting relatives or friends, or also people going to public places like you just mentioned, Lake Mead and other places here around the community. So the interaction between people increased, and the level of exposure also increased because of that interaction. And this is something that we are experiencing since early June. So now, 4th of July is kind of, bringing that risk to exponential levels, because then more people are actively engaged in social communication and interactions as opposed to previous days. But we are seeing this again since early June because more people are being out there. Also, what we have seen is the population who is actually more socially active, and also the segment of the population that is actually more related to labor, to work, people between 24 years old to 50, 60 years old. Those are the people who have the highest rate of number of new cases reported in our community, which of course that's pretty much correlate with the reopening of the economy and people going back to work, but also people engaging in more social interactions.
The governor just last week, exactly a week ago today, had announced that closure of bars and taverns that don't serve food in a way to, I guess, minimize the congregation of people in social settings to slow the spread of COVID-19. We know that that took place in 7 counties. Are you in communication with the governor's office? Has he asked for your expertise or your opinions about potentially other closures or more closures? One of the things that someone had reached out to us was asking about was the hair salons, the beauty parlors, those kinds of things that were shut down in earlier phases of our kind of mitigation efforts for COVID-19. What's the situation with that? Are you recommending or potentially more closures?
Well, we have a close communication with the Nevada State of Health, the behavioral health, and we communicate with them in pretty much in daily basis and exchange information. We are not active participants at the governor task force. So when the governor make decisions, he has a group of health experts who actually provide that level of consultation and resources for him. So we are not a part of that group. We do share our information or concerns with other members of the state health department here in Nevada and the county, and that's how we work. But we are not direct participants on the governor decision making.
Gotcha. If you did have a seat at the table, would you recommend additional closures?
Well, that's something, again, I don't want to speculate on that because, again, I don't want to get into a situation where, okay, I'm saying something, the governor's office or his task force think a different way. I don't want to get into that kind of situation. What I can tell you is that we provide to them as much information that as we can whenever we are asked, and we are always willing to contribute to anything that they need us to contribute.
Hospital capacity, I got word from UMC that their ICU beds are now more than 90% filled. Unclear of how many of those are COVID-19 patients. Are you watching or concerned about the hospital capacity as more hospitalizations occur, COVID-19 cases continue to go up?
Well, there is the Nevada Hospital Association and also a strong collaboration among local hospitals here in terms of the capacity for ICU or regular beds, and also how to expand that capacity when they consider that they need to do that. So there is a whole group working on that regard. Again, perhaps the best source of information could be the Nevada Hospital Association and those who are participating in that group. We receive information from them every day on the situation, and we give our feedback. And they, as a group, make decisions on how to better expand the bed capacity here based on the current situation.
My final question is about contact tracing. How's that going, and how are you handling this ever-growing caseload of trying to track down who people may have been in contact with, or potentially people who have been exposed?
Well, contact tracing has been a challenge for us in the last few weeks because again, the large increase in the number of daily cases that actually is beyond our surveillance unit capacity. So we have been in conversation with the state and the county, looking for assistance and additional resources for contact tracing. For example, we received assistance from the county. They provided 20 employees from the social service unit that are being trained with our staff, so they become active participants in contact tracing. So that will help our staff. Also, we had a conversation with the state, and this week the decision was made also to utilize a service that the state contracted with the company, the Lloyd company, that they help with contact tracing, but really the focus is more in the contacts as opposed to the initial investigation of the cases. That's where we are running behind. So they have 250 employees, and those employees will be starting next week, will be active participant in the initial investigation. So that will help us cut in the number that we are running behind. We also are working with the state and UNLV. They are training about 100 additional individuals who will be part of our contact tracing team. We expect them to be functional, some of them sometime next week, and eventually in the next couple of weeks, we will get those 100 individuals. And also we are now in conversation with other organizations here in Clark County in order to identify additional individuals who could join our contact tracing unit. In addition to that, we recently received a grant from the CDC, the federal government, and we will be hiring 83 additional contact tracers that will join our health district.
One other thing that just quickly popped into my head was I was hearing, getting reports that there is kind of like an overflow, or there's patients coming from other places, Arizona namely, that are coming in for support for or getting treatment here in Nevada. Do you have any details or information about that kind of facet and people kind of seeking treatment here in Southern Nevada from other states?
Sure. I mean, I don't have the numbers because that's not part of our active engagement on that. But yes, we do have the information. But that's a normal process, and it's something that happens, all year long. Because whenever you have neighboring communities, you will have patients going from Nevada to California or Arizona, or the other way around. So we know that in recent weeks there was an overflow in Arizona, and some patients have been transferred to hospitals in Nevada. That's part of the collaboration between states, and that's a regular standard thing that happens.
Okay. Dr. Fermin Leguen, I appreciate it. You are still the acting chief health officer for the Southern Nevada Health District. Nothing's
That's correct.
Right. I just want to make sure I get your title right. I always ask that because there always changes. Anything else I didn't ask you, Doctor?
No. Again, at this point, when there is not an effective treatment for the coronavirus, there is not an effective vaccine protecting against coronavirus, perhaps the most important thing is the individual personal responsibility, how we protect ourselves from the virus, and also how we protect those around us from the virus. And this is something where compliance with the preventive measures that we are recommending, like the use of the mask, or facial covering, or social distancing, hand washing, and some other elements are very important. And again, it's not just for us to wait for other people to protect us, but also we have to contribute to that just by doing our little things.
Doctor, thank you so much. I appreciate it. You take care and be safe.
Okay, thank you.
Thank you so
Thank
much.
you.